I'm going to tell you something that might shock you. The number one killer of women in the United States is not breast cancer. It's not ovarian cancer. It's not lung cancer. It's not any cancer at all. The number one killer of women in America is heart disease. Cardiovascular disease kills more women every year than all forms of cancer combined. Let me say that again, because I need it to land. Heart disease kills more women than all cancers combined. And yet, when I ask women in my practice what health risk concerns them most after 50, almost every single one says cancer. Almost none say heart disease. This disconnect between the reality of the threat and the perception of the threat is literally killing women. Because women who don't know they're at risk don't take steps to protect themselves. Women who don't know the symptoms don't call 911 when they should. Women who think heart attacks only happen to overweight men who eat cheeseburgers don't recognize that the tightness in their jaw, the nausea they can't explain, the exhaustion that won't go away, could be their heart crying for help. I'm Dr. Elena, and today we're going to have a conversation that could save your life. I am not exaggerating. I am not being dramatic. Cardiovascular disease is preventable, it is treatable, and your risk increases dramatically after menopause for reasons that are directly tied to the hormonal changes we've been discussing on this channel. By the end of this video, you will understand why your heart is more vulnerable now than it was 10 years ago, what symptoms to watch for that are completely different from what you've been taught, and exactly what you can do, starting today, to protect yourself. This is not optional viewing. This is essential. Stay with me. Let me start by explaining the estrogen connection, because this is the piece that ties everything together with what we've been discussing on this channel. Before menopause, women have a significant cardiovascular advantage over men. Premenopausal women have lower rates of heart disease, heart attacks, and stroke compared to men of the same age. This female advantage is largely thanks to estrogen. Estrogen is a powerful cardiovascular protector. It helps keep blood vessels flexible and dilated, promoting healthy blood flow. It helps maintain a favorable cholesterol profile, higher HDL, the good cholesterol, and lower LDL, the bad cholesterol. It has anti-inflammatory effects on the blood vessel walls, reducing the buildup of arterial plaque. It helps regulate blood pressure, and it improves the function of the endothelium, the inner lining of your blood vessels, which is critical for vascular health. Think of estrogen as a cardiovascular shield. For decades, it's been protecting your heart and blood vessels, quietly, in the background, without you ever knowing. And then menopause happens, the shield drops, and within 10 years of menopause, a woman's cardiovascular risk catches up to, and in some cases exceeds, a man's risk. This is not a gradual, negligible increase. It's dramatic. After menopause, LDL cholesterol levels tend to rise. HDL cholesterol may decline. Blood pressure often increases. Blood vessels become stiffer and less responsive. Inflammatory markers increase. The risk of metabolic syndrome and type 2 diabetes rises. All of these changes accelerate the process of atherosclerosis, the buildup of plaque in your arteries, which is the underlying cause of most heart attacks and strokes. And here's the cruel irony. Many of these changes happen silently. You don't feel your cholesterol rising. You don't feel your arteries stiffening. You don't feel plaque building up in your coronary arteries. There are no obvious symptoms until one day there's a crisis. And for too many women, that crisis is the first indication they had a problem at all. Now I need to talk about something that is critically important and could literally be the difference between life and death for you or someone you love. Heart attack symptoms in women are different from heart attack symptoms in men. And most of what you've been taught about heart attacks, from movies, from TV shows, from public health campaigns, is based on the male presentation. The classic Hollywood heart attack. A man clutches his chest in sudden, crushing pain, grabs his left arm, and collapses. That can happen in women too, but in many cases, some studies say up to half of female heart attacks, the symptoms look nothing like that. Here are the heart attack symptoms that women are more likely to experience: unusual fatigue, Not the I had a long day kind of tired, but a profound, sudden, unexplained exhaustion that comes on without reason. Some women describe it as feeling like they can barely lift their arms or walk across a room. This can start days or even weeks before a heart attack. Shortness of breath, difficulty catching your breath, feeling winded from activities that normally wouldn't bother you, or waking up breathless in the night. Nausea, vomiting, or indigestion. Many women having a heart attack think they have a stomach bug or food poisoning. They reach for antacids instead of calling 911. Pain or discomfort in the jaw, neck, back, or between the shoulder blades. Not chest pain, but aching or pressure in these other areas. Dizziness or lightheadedness. Cold sweats, a sudden clammy sweat that's different from a hot flash. Though I understand that during menopause, distinguishing between the two can be confusing. Chest pressure or tightness. When women do experience chest symptoms, they're more likely to describe it as pressure, squeezing, or tightness, rather than the crushing pain men typically report. It may feel like an elephant sitting on your chest or like a tight band around your rib cage. And sometimes, and this is the most dangerous scenario, women experience what's called a silent heart attack. Minimal symptoms, or symptoms so vague that they're brushed off. Fatigue, mild nausea, a funny feeling. These are not dramatic. They don't scream emergency. And that's exactly why they're so deadly. Here's what scares me most. Because women don't recognize their symptoms as cardiac, they delay seeking help. Studies show that women wait significantly longer than men to call 911 when they're having a heart attack. They wait because they think it's heartburn. They wait because they don't want to make a fuss. They wait because they think heart attacks don't happen to women. And every minute of delay means more heart muscle dying, more damage, worse outcomes. So I want you to remember this. If you experience any combination of the symptoms I just described, especially if they come on suddenly, especially if they're new and unusual for you, especially if something feels seriously off in a way you can't explain, call 911. Do not drive yourself to the hospital. Do not wait to see if it gets better. Do not call your daughter and ask her opinion. Call 911. Let the paramedics determine whether it's a heart attack. If it turns out to be heartburn or a panic attack, you have lost nothing except a trip to the ER. If it turns out to be a heart attack, you may have just saved your own life. There is no prize for being stoic. There is no award for not making a fuss. But there are funerals that didn't need to happen because a woman decided she didn't want to bother anyone. Now let's talk about risk factors, because understanding your personal risk profile is the first step in protecting yourself. Some risk factors you can't change. Your age, risk increases after menopause. Your family history, if a parent or sibling had heart disease, especially at a young age, your risk is higher. And your race, Black and Hispanic women have higher rates of cardiovascular disease than white women in the US. But many of the most significant risk factors are modifiable, meaning you can change them. High blood pressure is the single most important modifiable risk factor for heart disease in women. And here's the problem. Blood pressure often rises after menopause due to the loss of estrogen's vasodilating effects. Many women who had perfect blood pressure their entire lives discover in their 50s that their numbers are creeping up. If you don't check your blood pressure regularly, you won't know. Get a home blood pressure monitor. They're inexpensive and accurate. And check your pressure several times a week. Normal is below 120/80. If your readings are consistently above 130/80, talk to your doctor. This is not something to watch and wait on. High blood pressure damages your arteries silently and relentlessly. High cholesterol, specifically high LDL and low HDL, is another major risk factor. After menopause, your lipid profile often shifts in an unfavorable direction. Get your cholesterol checked annually. If your numbers aren't where they should be, work with your doctor on a plan, which might include dietary changes, exercise, and potentially medication like statins. And let me say something about statins because there's a lot of fear and misinformation around them. Statins are one of the most studied and most effective medications in the history of cardiovascular medicine. They lower LDL cholesterol, reduce inflammation, and have been proven to prevent heart attacks and strokes. For women at elevated cardiovascular risk, statins can be life-saving. If your doctor recommends one, have an honest conversation about the benefits and risks for your specific situation. Don't refuse based on something you read on social media. Diabetes and insulin resistance, which, as we discussed in our weight video, become more common after menopause, significantly increase cardiovascular risk. High blood sugar damages blood vessel walls and accelerates atherosclerosis. If you have diabetes or prediabetes, managing your blood sugar is one of the most important things you can do for your heart. Smoking is devastating for cardiovascular health. If you smoke, quitting is the single most impactful thing you can do to reduce your heart disease risk. No amount of exercise or healthy eating can overcome the damage that smoking does to your blood vessels. Physical inactivity is an independent risk factor, meaning that being sedentary increases your heart disease risk, even if all your other numbers are good. The cardiovascular system was designed to be used. Your heart is a muscle, and like any muscle, it needs regular exercise to stay strong. Obesity, particularly visceral obesity, the belly fat we discussed in our weight video, increases cardiovascular risk through multiple mechanisms, including inflammation, insulin resistance, and blood pressure elevation. Stress and mental health also play a role. Chronic stress, depression, and social isolation have all been identified as cardiovascular risk factors. The mechanisms are both behavioral. Stressed, depressed people are less likely to exercise, eat well, and take medications consistently. And physiological. Chronic stress directly damages blood vessels through cortisol and inflammatory pathways. Taking care of your mental health is taking care of your heart. They are not separate concerns. And there are some cardiovascular risk factors that are uniquely female, things that your cardiologist might not even ask about. Pregnancy complications, particularly preeclampsia, gestational diabetes, and pregnancy-induced hypertension, are now recognized as significant long-term cardiovascular risk factors. If you had any of these conditions during pregnancy, your risk of heart disease later in life is elevated. This information may have seemed irrelevant when you were 30, but at 50, it matters. Make sure your doctor knows your pregnancy history. Polycystic ovary syndrome, PCOS, is associated with increased cardiovascular risk due to its connection with insulin resistance, inflammation, and metabolic syndrome. If you were diagnosed with PCOS earlier in life, that diagnosis still has implications for your heart health after menopause. Autoimmune diseases, lupus, rheumatoid arthritis, and others are far more common in women than men, and they carry significant cardiovascular risk due to chronic inflammation. If you have an autoimmune condition, your cardiovascular monitoring should be more aggressive, not less. Breast cancer treatment, specifically certain chemotherapy drugs and radiation to the left chest, can damage the heart muscle and blood vessels. If you've undergone breast cancer treatment, cardiac screening should be part of your survivorship care. And premature menopause, whether natural or surgical, before age 40 is itself an independent cardiovascular risk factor due to the extended years without estrogen protection. These female-specific risk factors are often invisible in standard cardiac risk calculators, which were largely developed based on male populations. This is yet another example of how the medical system was not designed with women's bodies in mind, and why you need to be your own advocate. Now let's talk about what you can do to protect your heart. And I want to frame this not as a list of deprivations and sacrifices, but as an investment in the decades of life you have ahead of you. Because women over 50 today can reasonably expect to live another 30 to 40 years. That's a lot of life, and the quality of that life depends enormously on the health of your heart. Exercise. I've said this in previous videos and I'll say it again. Regular cardiovascular exercise is one of the most powerful medicines available. It lowers blood pressure, improves cholesterol profiles, reduces insulin resistance, decreases inflammation, strengthens the heart muscle, and reduces stress. The American Heart Association recommends at least 150 minutes per week of moderate intensity aerobic activity That's brisk walking, swimming, cycling, dancing, or 75 minutes of vigorous activity, plus at least 2 days per week of strength training. This isn't a suggestion. For your heart, this is a prescription. If you're not currently exercising, start small. Walk 10 minutes a day, then 15, then 20. Build gradually, but start. Nutrition. The Mediterranean diet, which I've recommended for brain health and weight management, is also the best studied diet for cardiovascular health. Rich in vegetables, fruits, whole grains, fish, olive oil, nuts, and legumes. Low in processed foods, refined sugars, excessive red meat, and sodium. The DASH diet, dietary approaches to stop hypertension, is specifically designed for blood pressure management and is also excellent for overall heart health. Both emphasize whole, unprocessed foods, and both have strong evidence behind them. Limit sodium to less than 2,300 milligrams per day, and ideally closer to 1,500 if you have high blood pressure. Most sodium in the American diet comes from processed and restaurant foods, not from the salt shaker on your table. Reading nutrition labels is the fastest way to identify and reduce hidden sodium. Increase your intake of omega-3 fatty acids from fish, salmon, mackerel, sardines, trout, at least twice a week. Omega-3s have anti-inflammatory and anti-arrhythmic properties that are specifically protective for the heart. Blood pressure management. If lifestyle changes aren't enough to bring your blood pressure into the normal range, medication is appropriate and should not be viewed as a failure. Uncontrolled hypertension is the #1 driver of stroke in women, and stroke is the third leading cause of death in women and the leading cause of long-term disability. Taking a blood pressure medication is not a sign that you didn't try hard enough. It's a sign that you're taking your health seriously. Cholesterol management. Get it checked annually. Know your numbers. Work with your doctor on a plan. If medication is recommended, take it. I've seen too many women refuse statins because they want to try diet and exercise first, which is reasonable for a period of time, but then never follow through on the diet and exercise, and their cholesterol stays elevated for years while plaque silently builds in their arteries. Be honest with yourself about what you will actually do and make decisions accordingly. Blood sugar management. If you have insulin resistance, prediabetes, or diabetes, managing your blood sugar is cardiovascular protection. The strategies we discussed in the weight video, strength training, protein, reduced refined carbs, sleep, stress management, all apply here. Let me address the hormone therapy question as it relates to heart health, because this is nuanced and important. The relationship between hormone therapy and cardiovascular health depends heavily on timing. The timing hypothesis, supported by substantial evidence, suggests that women who start hormone therapy early, within 10 years of menopause onset or before age 60, may actually receive cardiovascular benefit from estrogen. Estrogen's protective effects on blood vessels appear to be most relevant when the vessels are still relatively healthy. In contrast, starting hormone therapy later, more than 10 years after menopause or after age 60, when significant atherosclerosis may have already developed, may not provide the same benefits and could potentially increase certain risks. This is another reason why I encourage women not to suffer in silence through menopause for years and years before seeking help. The window for maximizing both symptomatic relief and potential cardiovascular benefit is early, during the menopausal transition and the first decade after menopause. If you're in that window, the cardiovascular effects of hormone therapy are generally favorable. If you're past that window, the decision becomes more complex and requires careful individual assessment with your doctor. I want to also mention some cardiovascular concerns that are uniquely female and often overlooked. Spontaneous coronary artery dissection, SCAD, is a condition where the wall of a coronary artery tears spontaneously without the typical risk factors for heart disease. It disproportionately affects women, including young, fit, otherwise healthy women. It's rare, but it's important to know about. Takotsubo cardiomyopathy, also called broken heart syndrome, is a temporary weakening of the heart muscle triggered by intense emotional stress. It overwhelmingly affects postmenopausal women and can mimic a heart attack. It's usually reversible, but it requires medical attention. Microvascular disease, disease of the tiny blood vessels in the heart rather than the large coronary arteries, is more common in women than men and can cause chest pain and other cardiac symptoms even when a standard angiogram looks normal. This is one reason women's heart disease can be harder to diagnose. The standard tests are designed to find blockages in the large arteries, and they may miss disease in the small vessels. I want to give you a clear action list because your heart depends on it. This week, buy a home blood pressure monitor and start checking your blood pressure several times a week. Record the numbers. This month, get blood work, a complete lipid panel, fasting glucose, hemoglobin A1C. Know your numbers. If you don't have a recent number for any of these, ask for the tests at your next doctor's appointment. And let me bust a common myth while we're at it. For years, many women were told to take a daily low-dose aspirin for heart protection. The guidelines have changed significantly. For most women who have not already had a heart attack or stroke, routine daily aspirin is no longer recommended because the risk of bleeding outweighs the preventive benefit for the general population. If you're currently taking daily aspirin for your heart based on old advice, talk to your doctor about whether it's still appropriate for your specific situation. Don't stop it on your own without medical guidance, but do have the conversation. I also want to encourage you to ask your doctor about a cardiac risk assessment, specifically your 10-year cardiovascular risk score. This is a calculation based on your age, blood pressure, cholesterol, smoking status, diabetes status, and other factors. It gives you a concrete number, your percentage chance of having a cardiovascular event in the next 10 years. This number is powerful because it takes the abstract concept of heart disease risk and makes it personal and specific. If your 10-year risk is 5%, that tells you one thing. If it's 15%, that tells you something very different about how aggressively you should be managing your risk factors. Ask for this number, write it down, use it as motivation. This month, calculate your daily step count and your weekly exercise minutes. Be honest. If you're below 150 minutes of moderate exercise per week, make a plan to get there. Ongoing, eat more fish, more vegetables, less processed food, less sodium. This isn't about perfection. It's about gradual, consistent improvement. If you smoke, please start a cessation program. Talk to your doctor. There are effective medications and programs that can help. This is the single most impactful change you can make for your heart. If you're in the early years of menopause, discuss hormone therapy with your doctor, not just for symptom relief, but as part of your cardiovascular health strategy. And most importantly, learn the female symptoms of a heart attack and share them with every woman you know. Write them on a sticky note and put it on your refrigerator. Tell your daughter, tell your mother, tell your friends, because recognizing the symptoms and acting quickly is the difference between surviving and not surviving. It's that simple and that serious. One last thing. I want to talk about something that doesn't get discussed enough: the psychological barrier to women seeking emergency cardiac care. Even when women know the symptoms, many hesitate to call 911 because they don't want to be dramatic. They don't want to waste the paramedics' time. They don't want to be embarrassed if it turns out to be nothing. This is a societal problem. We've raised women to minimize themselves, to put others first, to not make a scene. And in the context of a cardiac emergency, that conditioning can be lethal. So I want to plant a seed in your brain right now, a seed that I hope will grow strong enough to override every instinct to minimize yourself in an emergency. If something feels wrong, really wrong, in your chest, your jaw, your back, your breathing, you call 911, period. You don't negotiate with it. You don't poll your friends. You don't wait to see if it passes. You pick up the phone and you call because you matter. Your life matters. Your presence in this world matters. And no one is going to think less of you for calling 911 when something felt terrifyingly wrong in your body. Even if it turns out to be nothing, the paramedics will tell you that you did the right thing, because you did. Thank you for staying with me through this entire video. I know it was heavy. I know it was serious, but I hope you feel empowered rather than frightened, because knowledge is the antidote to fear, and you now have knowledge that can protect you for the rest of your life. Please subscribe if you haven't already. Share this video, not casually, but intentionally. Send it to a specific woman in your life with a message that says, please watch this, it's important. That's not being pushy, that's being loving. Leave me a comment, tell me your heart health story, your questions, your concerns, and most importantly, make that appointment, get those tests, and start treating your heart with the respect and attention it has earned after all these years of keeping you alive. I'm Dr. Elena, and I'll see you next week. Take care of your heart. It's been taking care of you your whole life. Now it's your turn to return the favor.